Good
I'm
morning.
Teresa Wilson, President of the Val Foundation, here with Lisa Mancini, Chief Clinical Officer at Helio Health, for a spotlight interview as part of the 2020 Oswego County State Fair. Hi, Lisa.
Morning, how are you?
I'm great, thanks. Lisa, please give us a little history about Helio Health and its mission.
Sure. So Helio Health actually is celebrating our 100-year anniversary this year. Unfortunately, with COVID, we're not able to celebrate like we would like to. But we do trace our roots going back to 1920 to a nonprofit, way back then. In 1959, we had the first certified men's community residents to serve individuals with alcoholism. And from there, we kind of expanded into other levels of treatment. Today we have outpatient services, inpatient services, as well as additional residential services that have grown since that time. Our mission is to promote recovery from the effects of substance abuse and mental health and other health issues in our community.
Great, thank you. What services do you provide for folks in Oswego County?
Sure. So for individuals in Oswego County, we serve a lot of individuals from Oswego in our services that are in Syracuse, our physical locations. So any of those services are certainly available to folks in Oswego County. But more specifically, we do have a program called CODI, which stands for Center of Treatment Innovation. And what the CODI team does, it's a grant-funded program that was funded by OASIS a few years ago. And we cover about 5 counties in the central New York region, with Oswego being one of them. But this is a team of mobile peers and clinicians that can come out and respond to an individual's home, meet them at a Dunkin' Donuts, meet them in a parking lot, wherever the individual feels safe engaging with somebody to discuss treatment options. Our team will come right to them, right to their family, and meet with them and try to engage them into services if that's what they're interested in. We also, I think we'll talk about this a little bit more later, but we also have the Regional Open Access Center for Addictions in Syracuse, which again covers the central New York region, including Oswego County. So that's another service that can help do assessments and connect people to services as well. So any of our services in Syracuse are open and accessible to folks in Oswego, but those 2 services specifically are targeted for the region, and certainly Oswego is one of those counties that we seek to assist.
Wonderful, thanks. Lisa, tell us about the new regional inpatient facility, Elements of Central New York.
Sure. So Elements is a newer program that opened in February of this year. Elements actually is, although it kind of, looks like an inpatient program in terms of its setup, it's actually a residential program under the OASIS regulations. A couple years ago, OASIS has decided to change their regulations in terms of residential and go from the older model that has community residences and supportive living to a new model that includes multiple levels of care called stabilization, rehabilitation, and reintegration. So this new program, Elements, which is located in Liverpool, actually contains all 3 of those elements of care in one building. So hence the name Elements. We include all the 3 options that OASIS offers. So that's a 75-bed facility located in Liverpool, as I mentioned, that offers 55 beds of the stabilization and rehabilitation, which are the 2 kind of higher levels of care in that setting. And then we have 20 apartments, they're efficiency apartments that are the reintegration program. So the stabilization level of care is a really great option for individuals who maybe need some assistance with some, very mild withdrawal symptoms, suffering from some pretty severe cravings that they may not be able to manage on their own. It's a fairly short length of stay for stabilization. It could be, a week to 2 weeks potentially in that level of care. There's medication management available. We have medical staff on site daily in that program to support individuals who may be, still feeling those withdrawal symptoms and having some medical or psychiatric complications. The next level of care that program offers is called residential rehabilitation. So that, again, will still help individuals who, are still having some cravings and urges. It focuses a lot on just healthy behaviors. So helping individuals prepare to go back and live independently in the community. It's focused a lot on socialization, educational, vocational services. We have a vocational counselor on site. We have a psychiatric nurse practitioner, a psychiatrist that comes in and sees individuals, and as I mentioned earlier, nursing on site daily to help ensure individuals are taking their medications appropriately and to provide any support that they may need in that regard. The reintegration program is a bit more independent. We still have case managers that would work with individuals and help them towards educational, vocational goals, financial goals, so that they will eventually be able to move out of that efficiency apartment and into their own apartment in the community, more independently. Individuals can enter that program at any level of care. They don't have to come in at stabilization and kind of move through. They could be admitted directly into stabilization, into reintegration, or the rehabilitation levels of care.
Thanks, Lisa. Do you have any openings in those programs?
We do. Actually, I checked yesterday. There are still some beds available in the stabilization and the rehabilitation program. It does change daily because the length of stay can be fairly short, especially as I mentioned for that stabilization. It could be, 2 weeks or so or less. So if somebody comes for stabilization and chooses to go to another program or return home and go to outpatient, people could come and go in a couple of weeks. So it does change daily, but there are beds available. The reintegration level of care, which is those apartments, tend to have a longer length of stay. We do have just a couple open at this point in time. Again, I looked at it yesterday, so I'm not sure if folks are planning to move in this week, but there were a couple apartments available as of yesterday. But as I mentioned, those, that can change if folks move in. That has a little bit longer length of stay, so they don't open as much as those stabilization and rehab beds.
Thank you. Now you have another facility called Willows. Can you tell us a little bit about that one?
Sure. So the Willows is an inpatient program. So that program has 65 beds, and it has beds that are called medically supervised withdrawal and stabilization. So those are commonly referred to as detox services, although they are, they're community-based. They're not actually, a hospital detox, but we are able to work with individuals who have moderate to mild withdrawal symptoms of that level of care. And that's a pretty short length of stay. So the medically supervised withdrawal and stabilization is usually about 3 to 5 days in that level of care. And then in the same building, we do have an inpatient rehab, that's a part of that program as well. It's about a little bit longer, maybe 3 weeks would be an average length of stay for that program. And it provides individual and group counseling. We have nurses on site 24 hours a day to, again, support medication management, vital signs, anything that may be going on with the individual in that program. It's been a nice transition now that we have elements that individuals can come into the Willows, go to the withdrawal and stabilization services, potentially into the inpatient rehab. And it's a nice transition from the Willows actually into the Elements program. It is a lower level of care. So folks who may be completing 3 weeks at the Willows, but still need some additional structure before they're, ready or feeling comfortable to go back into the community and live independently, they could transition into Elements and have some additional, that supportive staff that's available kind of 24/7. But again, the Willows is a little bit more medically focused because it's an inpatient, and then the residential at Elements is a little bit more social, leisure, vocational, educational. We have a certified peer recovery advocate on staff that will work with folks and help them develop some recovery plans for when they, leave and go back into the community. So both of those programs are a great option for folks who need some support to, kind of be independent in the community with their recovery.
And are there openings at Willows at this time?
There are on the Willows. Again, it varies. The Willows typically runs at about 90-95% utilization throughout the month. So they do stay pretty full. So it is, again, it varies day by day. So again, I did check yesterday and they had a couple beds open, but there are a much shorter length of stay than Elements. So even if someone were to call today and there was not a bed, that could change, it could change that day, it could change the next day. So don't be discouraged. There is a lot of more turnover in that program because of that very short length of stay, the 3 to 5 days in the detox, and then the 3 weeks in the inpatient. So it's pretty accessible. There's not usually quite a long wait to get into that program.
Sounds like a wide variety of programs. Do you tailor them specific to the individual's needs?
Yeah, so we really try to provide patient-centered care. So working with individuals to tailor their treatment towards what they want to work on. At our inpatient program, we do offer a variety of group counseling sessions, and when a person is coming into the program, they are able to kind of look at, I guess I call it like a menu of services, and they may be able to attend groups that are specifically for individuals with co-occurring disorders or folks who are involved in the criminal justice system. So they can kind of attend groups that are relevant to their particular situation so that they can get the most out of treatment that they can while they're there. We have the counselors that work there, and also our discharge planners will work with individuals to develop a discharge plan that meets their goals, whether they want to move into a residential program, if they have a safe place to return home and go to outpatient, that can be explored with the individual. So definitely each program and discharge plan is tailored, to the individual and what they would like to work on.
Thank you. That sounds like a lot of hope for people. A lot different than it used to be. It's not just as straightforward. This is how you do it. You got choices.
Exactly.
And that probably makes a lot of people feel better about getting treatment.
Yeah, because everybody's not the same, and everybody comes from a different place and has different, skills and tools in place for them. And we want to be able to, provide people with what they need instead of providing, a cookie cutter approach that everybody needs the exact same thing to be successful.
Great. Lisa, tell us about the Regional Open Access Center for Addiction.
Sure. So we lovingly call that ROCA because that's quite a mouthful to say what you just did. So the ROCA is located in Syracuse at 329 North Salina Street, which is also the home of our outpatient clinic. But essentially, ROCA is a 24/7 service that provides assessment and referrals to individuals that are seeking assistance. So somebody can walk into the clinic, or now, with COVID, we've really moved a lot of things to telehealth. We're doing a lot of things telephonically. So somebody could call or walk in if they prefer. We are doing screenings at the door to ask about risk factors. We're taking temperatures, making sure that people are safe if they do come to the building. But somebody can walk in. We have staff physically there 24 hours a day. They can meet with a person who's maybe contemplating services and doesn't really know where to start, or maybe they know exactly what they're looking for, and they're coming in to see if that somebody at the program can help them get there. But we'll do an assessment with the person, determine what would be the appropriate level of treatment for them if that's what they're interested in, and we'll make a referral to get them there. If they do need a detox or an inpatient level of care, we try to get them there right then. We don't want to send them home and give them an appointment for 2-3 days later. If at all possible, we will make those phone calls and we'll drive them there, right then and there. It's not an inpatient program, but if somebody were to come in, at 2 a.m. or midnight, we will allow them to stay with us, until the morning when we can get them, drive them to a program. Sometimes programs don't have the capacity, or there isn't somebody available to, make the decision to say, yep, bring them on over, admit them. So we'll allow the person to stay with us. We can, monitor them. We'll, give them something to eat while they're waiting. And then in the morning, we'll make some phone calls and get them over to wherever we can, if there's a bed available.
Great. So if someone wants to do an assessment or talk about these things via online, like telehealth, similar to how we're doing this interview, that is available for people?
Yeah, We're using, we're using right now Microsoft Teams a lot with our patients. So they're able to, they can call, we can do things over the phone, and they can have phone conversations, or we're also able to send them a link similar to Zoom where they would just click on a link and they're able to do this video chat with a counselor as well. So we've been doing a lot of that. We are also narrowing down our search for just a permanent telehealth, an actual telehealth platform besides Teams or Zoom, because I think that COVID has shown us there's a lot of ways to be efficient in providing services and not having folks travel. It makes it easier for maybe a parent to receive services if they have kids at home and they're not able to come into the clinic to receive services. Telehealth may be a much better option for them. We've seen some improvement actually in our rates of individuals attending their medication management appointments, because those appointments typically are short if somebody's already on a medication and it's a follow-up with their provider to just get some updates or a refill. They may be a 15-20 minute appointment if everything else is going okay. We've actually seen an increase in our patients showing up for those appointments via telehealth than they were in person, because they don't have to take a 20-minute bus ride to and from for a 15-minute appointment. They can just simply press a link and log in and see their provider and go back about their day. So we are looking to planning to make telehealth a more permanent part of our services in the future. But today with COVID, we are certainly doing that. We want people to stay home and stay safe. We understand that not everybody has internet. We understand there's parts of, several of the counties we work with, including Oswego, that do have, difficult time with internet access. And sometimes the video is difficult for folks to do if they don't have good internet access or a laptop or a good smartphone. So we are able to do a lot of things just over the telephone right now as well. So we don't want there to be any barriers to people receiving services during this pandemic or at any time.
I really think that telehealth and over the phone is a super idea in so many ways. I mean, if someone wants someone to talk to, they don't have to think about arranging a ride or finding transportation or the stigma of other people wondering where they're going, what are they doing. There's so many benefits to that. I'm really happy that it's getting geared up to be very good service.
Yeah, exactly. I think also the beauty, as I mentioned earlier, of the CODI team, we have the Center of Treatment Innovation, is that they also will come, they will come to you. So that was even before the pandemic. But transportation, especially from, some of the surrounding counties that we work with, to get to Syracuse to the Open Access Center could have been a challenge. So the CODI team, I think they're both really great services for folks who are looking to receive services, but maybe don't know exactly what program they want to go to. So, ROCA is a great option if they want to call us or come in person. We can see them there. Or CODI would be an alternative where we would come to you. So we could send somebody to your home or a place that you're comfortable, and we could do the assessment there instead of you coming to us. So either of those services are, we can do that safely, avoids the person having to, worry about transportation. But either one of those would be a great way for somebody to reach out and have an assessment and kind of figure out what would make sense for them in terms of treatment.
Can we talk a little more about these certified peers? If someone wanted a certified peer, which is someone who has been through the program, to come talk to you about your relative or yourself. What do you do? How do you get hooked up?
Sure. I think CODI would be a great place to start for that. CODI employs probably the most peers at our agency. They have a great team of peers that will talk with individuals or their families about, its treatment, what to expect, how to engage in services. And they come from, as you mentioned, they come from the perspective of somebody who's, in recovery or worked with or had a family member that's in recovery. So they really have a different perspective maybe than a clinician would. So they, they're very successful in engaging people in services and getting them, kind of working through, if somebody's kind of in that pre-contemplation, not really sure if they, want to go to treatment. Maybe they're a little bit worried about it. Peers are just excellent at really talking to them from someone who's been through it themselves, and how, maybe their life was improved after they received services, or decided to start attending 12-step meetings, or, whatever worked for them. They're able to share their experience, and just, their way doesn't mean that everybody else has to do it their way, but they come from it from a different perspective, and they are really quite successful in working with individuals, and it's really at their own pace. So it may take several conversations or several visits before somebody decides that they want to go to treatment or go to a meeting or call a counselor. But the peers that's what they're there for. So they will have as many conversations or discussions as it takes with the person before they decide they want to, make a change, but they'll be there to support them whenever they're ready for that.
Thank you, Lisa. Now, where can people get more information about all these programs at Helio Health?
Sure. So our website would be a great place to start. So our website is www.helio.health. So there's no org or com at the end. I know sometimes that can be confusing people, but it's Helio, HELIO.health is where folks can go to find out information about these services. Oasis also has a hope line that folks can call if they're looking for services or some support. So that's on the Oasis website as well, that's a more generic kind of helpline or hotline that folks can call for services. I do have some information for, Cody or for Roca. If folks want to call our open access center, the phone number is 315-471-1564. They can call there and speak to a counselor, or a peer at that number, and somebody should be available 24/7 at that location.
Thank you so much, Lisa, for being with me today.
Sure, thanks for having us.
Have a great day.
Thanks, you too.